Hello, everyone, and welcome to our podcast series. My name is Natalie Tornisi, and I wanted to talk a little bit about diabetes. Diabetes is considered a fast-growing chronic disease affecting millions of people. According to recent reports, more than 25 million people in the U.S. suffer from diabetes. The condition can affect many parts of the body, including your skin. About 1/3 of people with diabetes will develop skin problems, either related to or influenced by this condition. Most of the diabetes-related skin complications are harmless, but some can result in painful and persistent symptoms, which may require medical attention. The most effective treatment option for many diabetes-related skin conditions is effective blood sugar management. Proper control of your blood glucose level can help prevent diabetes-associated skin problems and many other symptoms from occurring in the first place. In other severe cases, a doctor might prescribe oral steroids, medicated creams, or another treatment. I'm going to go over some of the skin related disorders that come along with diabetes. And I'll also include a transcript of all associated ICD-10 codes of the conditions that I'll be talking about. The first one is Canthinosis Nicotines. It's a common skin pigmentation disorder characterized by areas of dark, velvety discoloration in body folds and creases. Notable signs of this condition are dark patches of skin with a thick, velvety texture. The patches may appear on skin folds and other areas such as the neck, groin, armpits, elbows, knees, knuckles, palms, and soles of the feet. It's not a disease, but a symptom of another condition that may require medical attention. The skin problem usually strikes people who are overweight. While there's no cure for it, losing weight may improve the condition, and treatment is largely focused on addressing the condition that is causing it. However, if the condition is caused by medications or supplements, your doctor may suggest discontinuing them or recommending substitutes. Vitiligo is a disease that causes the loss of skin color in blotches. This condition occurs when the cells that produce melanin die or stop functioning. It can affect any part of the body and may also affect the hair and the inside of the mouth. It can affect people of all skin types, but is most commonly seen in people with darker skin. Patchy loss of skin color is one of the initial symptoms of the condition, and in most cases the discoloration first shows on sun-exposed areas such as the hands, feet, arms, lips, face, and even the neck. Other related symptoms include premature whitening or graying of the hair, loss of color in the tissues that line the inside of your mouth and nose, and the loss of or color change of the inner layer of the eyeball. Treatment for vitiligo may restore color to the affected skin, but it does not prevent continued loss of skin color or a reoccurrence. Treatment options are medications and therapies like light therapy, depigmentation, skin grafting, micropigmentation in severe cases. The next one is Necrobiosis Lipoitica Nld. It's a condition related to diabetes, which results in reddish-brown areas of the skin, most commonly on the lower legs. The exact cause of the condition is unknown, but it's linked to blood vessel inflammation related to autoimmune factors. This damages proteins in the skin. Skin lesions occurring in the forearms are one of the most common symptoms. In some rare cases, these lesions can also occur in the stomach, face, scalp, palms, and the soles of the feet. It is very difficult to treat, but common treatment options include corticosteroid creams, injections, anti-inflammatory medications, medicines that improve blood flow, phototherapy, and laser therapy. In severe cases, the lesions may be removed by surgery, followed by grafting skin from other parts of the body. Eruptive Xanthomatosis is another skin condition that causes small, harmless yellow-red bumps to appear on the skin. These bumps are sometimes referred to as lesions, papules, plaques, or a rash. Severe insulin resistance can make it harder for the body to break down fats in the blood. This increases the level of fats in the blood, which can get deposited under the skin and form small bumps. It is very common among people with poorly controlled diabetes who have very high triglycerides and high cholesterol. It causes a group of round little bumps which look like a cluster of small, hard raised spots. They're usually found on the back of your arms, such as around your elbows, and on the back of your thighs, buttocks, and legs. In some cases, they can also show up around your eyes and other areas like the stomach, neck, back, knees, scalp, and face. These bumps cause symptoms like itching, pain, redness, and oozing. Generally, they go away within a few weeks or months. Diabetic blisters typically occur in people who do not control blood sugar well. They're usually clear bumps that have an irregular shape. They are painless and tend to heal on their own without treatment. They most often appear on the legs, feet, and toes, and less frequently can show up on the hands, fingers, and arms. This skin problem often occurs in people who have severe diabetes or diabetic neuropathy. Bringing your blood sugar level under control is one of the initial treatments for this skin condition. These blisters have a high risk of infection and ulceration. One of the primary ways to prevent the infection is to avoid puncturing or bursting the blisters. They may be treated with antibiotic creams, steroidal creams, and bandages to protect them from further injury. Granuloma Anulari is a skin condition that causes raised reddish or skin-colored bumps that spread outwards in a ring pattern. Bumps often occur on the hands, fingers, and forearms. The National Organization for Rare Diseases notes that Granuloma Anulari may be a common complication of diabetes or shingles, although it is unclear why the bumps develop. These lesions usually disappear on their own within 2 years without treatment. Treatment options, however, can include corticosteroid treatments, ointments, injections, freezing, light therapy, and other oral medications, which can help the bumps fade faster. Keeping your diabetes under control is one of the best ways to reduce the risk, severity, and frequency of skin-related complications of diabetes. I hope this helps, but always remember that documentation and a thorough knowledge of payer regulations and guidelines is critical to ensure accurate reimbursement for the procedures performed.